week's muscle breakdown, I'm going to be covering a very important muscle in the posterior part of the neck and the shoulder, something that's really deep, the serratus posterior superior. What's up, everybody? I'm Dr. Matt Maggio, creator of the Soft Tissue Revolution, where we show massage therapists a new treatment method that allows them to easily double their income, all while working 50% less. Back at it for one of my favorite segments, Muscle of the Week Breakdown. I'm going to be covering a very important muscle deep in the neck. It's called the serratus posterior superior. So serratus kind of goes all over the place. There's serratus anterior, serratus posterior superior. I can't even say them all right, but we're just going to say serratus posterior to get us in a good place. So this muscle is really important. It's kind of different from a lot of other muscles. So where it starts to attach is in through the vertebrae of like C7, T1, T2, and then it kind of runs down at an angle out into the shoulder blade. So it's muscular in that first like 2/3 of the muscle, but then it becomes very tendinous underneath the shoulder blade. Now, this muscle usually is involved in like breathing, like a secondary breathing muscle. But what I end up seeing a lot of dysfunction in is in cervical motion, specifically like cervical rotation. It helps with that twist and that turn of that head. And what happens is it's usually just a wreck on people, and it's so deep. You know, people spend so much time in just really lousy, just bad postures, and these muscles are just constantly stretched all day long. And when they get constantly stretched, they don't get enough blood and they don't get enough oxygen, and they actually start to lay down a lot of scar tissue. And then that just causes decreased flexibility, a lot of weakness in there as well. The problem is the serratus is really, really deep and it's hard to get to. It's usually one of the last muscles I get into when I'm going through a cervical spine treatment protocol. Usually with cervical spine, what we like to correct first is just like that global motion of flexion. And then we get into some of that rotation and start to open that up. But a lot of times you can't even get down into that serratus muscle until you clean up a lot of that dysfunction, you know, specifically in like the levator, in through the cervical erectors, and some of the lat that goes over top of there as well, in the trap as well. And you got to get in there and get all that out of the way so you can go in there a little bit deeper. But I tend to see this in people a lot that have had like chronic neck injuries, especially people that have had car accidents, just maybe football players, just repetitive overuse stuff, and people that really have a hard time checking their blind spot when they drive, that they have to be like they're like Frankenstein when they turn, have trouble cleaning up their neck into that rotation. So this muscle is really important, but it's not the first one that you go after. A lot of times people want to try to get in there on the really deep one, but you're not able to get on until you clear up everything else around there. So what I want to show this week is a palpation of this muscle and then demonstrating some treatment with our method called the peak method. And you can kind of see how to find it, how to go in there and fix it, because a lot of times that cervical rotation is going to be really important for just overall stability of the neck and longevity as well. Getting that flexion first is the most important, but this is kind of like the icing on the cake, and a lot of those chronic neck problems will get fixed if you can get in there and clean this up. So check that video out. This is the only muscle that we treat when cervical rotation is limited. It's the serratus posterior superior, and basically the serratus goes through here, in through there as well, and where it can get jammed up is all through this area. You can get it caught on the levator, you can get it caught on the rhomboid, the fascia, everywhere in there. Now the key here is this one's a little harder for the client to go through that motion. The first step is always you're going to bring that arm over and have them lock that in place. Now this one is a little bit different. So the motion for the client is going to be twofold. You're going to start them slightly rotated away, and then they're going to turn like that, as comfortable as they can go. They're not going to force it. And then once that happens, you want them to drop their other ear down to the floor. So it's in two separate motions. So you really want to slow that down. So you get this first part in here, and then you get the rest of that. That's going to help you pick up the rest of that tendinous area where that serratus comes. So the setup for this is really key. So you're going to have them slightly rotated. And what I'm going to do is I'm going to find that spinous process over here of C7, and I'm going to go in just like this. And you're just going to let it come to you. So it's nice and relaxed, very similar to other setups that we see with the levator. And you're going to come in at that 45-degree angle. You're going to go in just like that. You're going to sink in with your body. And then this one, you're actually going to pull some tension with your lat and drop that in. That's going to lock in that area. So I want you to kind of see, come a little closer. So without the thumb in there, you're going to get that depth in like that, and then your tension is like that. So now that it's set up, I'm going to go in just like that. I'm going to back that thumb up. You're going to get that depth with that body lean, and your tension is going to be dropping in, and the client is going to turn, 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 turn. You're going to feel that come over, and then they're going to drop that opposite ear. Now, a lot of times, this can be more of a difficult motion for the client as well. And this is one where I will go in and actually do the motion. It's not ideal, but if you're going to use your thumb in like this, you'll be here, and I'm going to help them with that motion. So I'll sink in with my body, and I'll pull tension like that, and then I will rotate them just like that as it comes. And then once it gets there, I'll drop their head down, just like that. So sometimes the client can't do the motion and they mess that up. And when that happens, you can't get an effective treatment. So essentially what I will do is I'll do the motion for them. So we'll sink in just like that here, and then I'll get the tension here, and then I will do the motion, moving their head and then dropping it in. It's not ideal, but if they can't relax or they can't do the motion, because a lot of times they'll turn their head and they'll drop it too quick, you want to be in control of this, because this area is very dysfunctional for that cervical rotation. If you can clean it up correctly, it's going to make a big difference. So I hope you enjoyed that video and it helped give you a better perspective on finding the motion on that, the specificity, I don't even say that right, the specific nature of how we find and deliver treatment. You know, so much treatment out there, especially in the massage world, is what I call like shotgun approach, where basically they just go in and treat a bunch of things and see what happens. In our methods, it's more of like what I call a sniper approach, where we line it up, we know exactly what it is, and we go in and we get it, and we get that kill shot on it and actually fix it. And that's what we teach in the Peak Method. If you're interested in learning more about that, all the information is listed down below. We're helping people all over. We're helping massage therapists get taken seriously as healthcare providers, making them become more of a solutions provider and starting to fix people for good. You know, when you can build that reputation of being able to fix people, know exactly what's going on with them, tell them how you're going to fix it, you're going to be in a whole different upper echelon of everyone else out there. So I appreciate you watching the video. If it helped you, you learned something from it, you know, give it a like, a comment, or share. If there's any other muscles you want us to cover, send a message. We're always here to help, and join and be part of our program, because it really can transform not just your business and your practice, but your life, and really set you up to be that true solutions provider. Appreciate you guys watching. We'll see you on the next one. Bye.